Revolutionary AI-controlled robot surgeon performs complex surgeries without human intervention. Imagine a world where surgeries are performed with utmost precision and accuracy, without the need for human intervention. This may seem like a futuristic concept, but it's now a reality, thanks to the groundbreaking work of American researchers from Johns Hopkins University, Stanford University, and Columbia University. They've developed an autonomous AI-guided surgeon robot that can perform complex surgical operations on its own, marking a significant milestone in the field of robotics and medicine. But here's where it gets interesting. This robot surgeon has the potential to revolutionize the way we approach surgery, making it safer and more efficient. For over 2 decades, robotic surgical systems have been assisting human surgeons in performing operations, but they've always required supervision. However, the AI-guided robotic surgical system created by these researchers is capable of thinking, adjusting, and performing surgical interventions independently. As Axel Krieger, a researcher from the Department of Mechanical Engineering at Johns Hopkins University, notes, "We were able to perform the surgery with a very high degree of autonomy. What we have done is actually a full-fledged operation." The SRT-H robotic system, guided by AI, has successfully removed gallbladders from pig cadavers in 8 separate operations, with 100% accuracy and without human intervention. This is a remarkable achievement, especially considering that gallbladder removal is one of the most common minimally invasive surgeries worldwide, with up to 700,000 operations performed annually in the United States alone. During these operations, surgeons must carefully locate the bile duct and artery, clamp them in specific areas, and make incisions to remove the organ. Mistakes can lead to bile spillage and damage to internal tissues, making it a challenging and delicate procedure. The SRT-H system accomplished this task using a combination of language learning, simulation, and 2-layer artificial intelligence. The high-level planner provided instructions in normal language, while the low-level controller transformed these instructions into real actions. This achievement allows us to move away from robots that can perform specific surgical tasks and towards systems that truly understand surgical procedures, as emphasized by Axel Krieger. In each of the 8 surgical interventions, the SRT-H completed all 17 stages without any errors, including gripping, clipping, cutting, tool change, and self-correction. The robotic system was trained on relevant databases, with over 16,000 demonstration surgeries on dozens of porcine gallbladders. Cameras mounted on the robot's wrists and an endoscope on the top of its head captured close-ups of the interaction between the instruments and the tissue, allowing the SRT-H to learn from what it saw. This enabled a high-level instructor to make necessary recommendations later, and the robot even asked for a tool change when needed. Although the robotic system performed the operation more slowly than human surgeons, it did so with greater accuracy, making less jerky movements and having a shorter tool path. The SRT-H is a high-level autonomy system under human control, meaning that all operations, from incision to wound closure, are performed without human intervention. However, the researchers acknowledge that their robotic system is still in the experimental phase, practicing on dead pigs to avoid unpredictable moments associated with real surgical operations, such as bleeding, breathing, and anatomical variations. More research is needed before the SRT-H can be used in human surgery. Currently, the system uses bulky cameras that wouldn't fit through laparoscopic ports, and while it can require tool changes, it still needs a person to reload clips and change tools. The researchers are exploring ways to improve the safety of their system, planning to extend its assessment of uncertainties that could signal a possible error, allowing real surgeons to intervene. The SRT-H can already be switched off using voice or touchscreen commands. As we consider the implications of this technology, we're forced to ask, are we ready to trust autonomous robots with our lives? Will this technology revolutionize the field of surgery, or will it raise more concerns than benefits? The debate is ongoing, and we'd love to hear your thoughts. Do you think autonomous robot surgeons are the future of medicine, or do you have concerns about their safety and efficacy? Share your opinions in the comments below. Breakthrough in surgical robotics: AI robot performs gallbladder surgery autonomously in 2025. A groundbreaking milestone has been reached in the field of medicine, with an experimental robot equipped with artificial intelligence successfully performing a complex segment of a typical gallbladder operation all on its own. This development, celebrated by researchers on July 9, marks a significant advancement towards fully automated surgical procedures. Traditionally, surgical robots rely on surgeons to control them remotely. The innovative system being studied, however, employs AI technology that allows it to make autonomous decisions and adapt to unexpected challenges that arise during surgeries. Axel Krieger, a key researcher from Johns Hopkins University in Baltimore, compared this achievement to the capabilities of an autonomous vehicle, which can skillfully navigate different terrains and circumstances, intelligently responding to various obstacles it encounters along the way. Krieger remarked, "This advancement shifts our focus from robotic systems that can merely carry out specific surgical tasks to ones that genuinely comprehend the intricacies of surgical procedures." The robot in question, named SRT-H, utilized a training technique dubbed language-guided imitation learning. It learned by analyzing videos of surgeons carrying out gallbladder removal surgeries using pig cadavers, according to findings published in the journal Science Robotics. To evaluate its effectiveness, the researchers conducted tests on a variety of pig gallbladders and livers that had been extracted from the animals. The separation of the gallbladder from the liver is not a straightforward task. It takes several minutes and involves various surgical techniques including grasping, clipping, and cutting, skills that are essential in real surgical environments. Furthermore, the robot demonstrated decision-making abilities and adapted its approach as needed. The pig organs' appearances and anatomical structures varied significantly, providing a realistic representation of the diversity that surgeons face in human surgeries. Remarkably, the robot achieved a flawless record in its surgical tasks, although it took more time to complete the procedures compared to a human surgeon. Currently, the most widely used surgical robots, like the Da Vinci surgical system from Intuitive Surgical, have assisted in over 12 million operations worldwide since their FDA approval in 2000. Unlike the SRT-H, the Da Vinci system requires complete human control of its movements from a distance. The global market for surgical robotics is on a growth trajectory, nearing $10 billion annually, with an estimated 2.7 million robotic procedures performed in 2024, according to David Scott, a Baird analyst. In the long run, autonomous surgical robots hold the potential to alleviate the shortage of surgeons, reduce human errors in the operating room, and deliver reliable, high-quality care to areas that are underserved. This research initiative has received backing from the Advanced Research Projects Agency for Health, the National Science Foundation, and the National Institutes of Health. But here's where it gets controversial. Could we eventually see robots completely replacing human surgeons, or is there an irreplaceable quality in human touch and expertise? What's your take on this emerging technology? Join the discussion. AI surgical robot revolutionizes modern medicine. Imagine a future where surgeries are performed with utmost precision and accuracy, without the risk of human error. This may seem like a distant dream, but the reality is that we're already on the cusp of a revolution in the field of surgery. Robots trained on hours of expert surgical videos can now perform complex operations with minimal human intervention, and this breakthrough is happening right now. But here's where it gets controversial. What if these robots could perform surgeries entirely on their own, without any human input? Would you trust an AI machine to operate on you or your loved ones? The answer to this question may seem simple, but it's a complex issue that raises important questions about the role of technology in healthcare. For the first time, an autonomous surgical robot has successfully completed a key phase of gallbladder removal on a lifelike patient, working independently and adapting in real time to unexpected challenges. This achievement is a significant milestone in the development of autonomous surgical robots, and it has the potential to transform the future of surgery. So, how did this robot learn to perform such a complex procedure? The answer lies in its training. Researchers at Johns Hopkins University fed the robot visual data and captions describing each step of the procedure, allowing it to learn the sequence and nuances of gallbladder surgery. This approach enabled the robot to identify ducts and arteries, place clips, and make precise cuts, all with remarkable accuracy. But what sets this robot apart is its ability to respond to voice commands from the surgical team. For example, it can understand instructions like, grab the gallbladder head, or move the left arm a bit to the left. This interactive feedback loop enables the robot to learn and self-correct, much like a surgical resident guided by a mentor. And this is the part most people miss. The robot's performance matched that of skilled human surgeons, handling unexpected scenarios with composure and precision. As Axel Krieger, lead researcher at Johns Hopkins University, noted, this advancement moves us from robots that can execute specific surgical tasks to robots that truly understand surgical procedures. The implications of this technology are profound. Autonomous surgical robots could one day lead to fully autonomous surgeries, potentially improving outcomes and expanding access to high-quality surgical care worldwide. But there are also concerns about the potential risks and consequences of relying on AI machines to perform surgeries. For instance, what happens if the robot makes a mistake? Who is accountable? These are important questions that need to be addressed as we move forward with this technology. The success of this autonomous surgical robot in gallbladder surgery is just the beginning. Researchers plan to train the robot on a wider range of procedures and further enhance its capabilities. The ultimate goal is a robot that can perform entire surgeries autonomously, adapting to the unique anatomy and challenges of each patient. So, what does this mean for you? If you've ever faced a long wait for surgery or worried about human error in the operating room, this breakthrough could directly affect your care. Autonomous surgical robots like this one promise faster procedures, fewer complications, and better access, especially in rural or underserved areas. With their ability to learn from real surgeries and adjust in real time, these robots could support overworked surgical teams and help reduce burnout. For patients, that means more consistent outcomes and shorter recovery times. While fully autonomous surgery isn't available in U.S. hospitals just yet, the technology is moving fast. What happened in a research lab today could be part of your next hospital visit sooner than you think. As Kurt Cyber Guy Knudsen noted, the arrival of autonomous surgical robots is changing medicine fast. By combining artificial intelligence, machine learning, and real-time feedback, these robots are ready to transform the operating room. As this technology improves, the gap between human skill and robotic precision will continue to shrink. This shift promises a future where surgery is safer and more efficient than ever before. So, we want to hear from you. If a robot can perform surgery with the skill of a top surgeon, would you trust an AI machine to operate on you or your loved ones? Let us know by sharing your thoughts in the comments. The future of surgery is here, and it's time to start thinking about the possibilities and consequences of this technology.